Every minute a stroke goes untreated, roughly 1.9 million brain cells die. That number, from the American Stroke Association, is why stroke is treated as one of the most time-sensitive medical emergencies that exists. Most stroke education focuses on how to recognize the signs in someone else. But strokes don't only happen with another person in the room. If you live alone, or you're simply alone when it starts, knowing exactly what to do changes everything about your outcome. This video walks through the real, medically accurate signs and the specific actions that matter most if you're by yourself. Why speed matters this much? A stroke happens when blood flow to part of your brain is interrupted, either by a blockage or a burst blood vessel. Without oxygen-rich blood, brain cells begin dying within minutes, which is why doctors describe stroke care with the phrase, "time is brain." The specific treatments that can dramatically limit long-term damage are time-limited. Clot-busting medication, most commonly a drug called TPA, is most effective when given within 4.5 hours of the first symptom, and a procedure to mechanically remove a clot can, in some cases, be performed up to 24 hours after symptoms start, but outcomes are consistently better the sooner treatment begins. This is also true for hemorrhagic strokes and for many stroke mimics, so speed is the right instinct essentially no matter which type is actually happening. The warning signs, F.A.S.T. The American Stroke Association uses a memory aid called F.A.S.T. to help people recognize stroke symptoms quickly, in yourself or in someone else. B is for balance, sudden trouble walking, dizziness, or a sudden loss of coordination. E is for eyes, sudden vision loss, blurred vision, or double vision, in one or both eyes. F is for face drooping. One side of the face droops or feels numb. If you're alone, you can check this by looking in a mirror or simply noticing if one side of your face suddenly feels wrong, heavy, or unresponsive. A is for arm weakness, sudden weakness or numbness in one arm. The classic test is raising both arms and seeing if one drifts downward, which you can absolutely do on yourself. S is for speech difficulty, slurred speech, difficulty getting words out, or trouble understanding what's being said. If you're alone, try saying a simple sentence out loud and notice if it comes out wrong. T is for time to call 911. If you notice any of these signs, even if they seem to pass or improve, the instruction from every major stroke organization is the same. Call 911 immediately. Don't wait to see if it gets better, and don't try to drive yourself. It's worth knowing that women sometimes experience additional or different symptoms beyond the classic signs above, including nausea or vomiting, general weakness, fainting, shortness of breath, sudden uncontrollable hiccups, and unusual extreme tiredness at the onset. If something feels seriously wrong, even if it doesn't match the classic list exactly, that's still a reason to call for help rather than wait. What to actually do if you're alone and you notice these signs? This is the part most stroke education skips, because most materials are written assuming someone else is present to help. If you're by yourself, here's the sequence that matters most. Call 911 first, before anything else. This is the single most important action, and it needs to happen before you try to text a family member, look up symptoms online, or decide whether it's serious enough to bother anyone. Stroke specialists specifically note that some people hesitate to call for fear of bothering emergency services over something that might turn out to be nothing. That hesitation is exactly the wrong instinct here. Calling and being wrong costs you an inconvenience. Waiting and being right cost you brain function you may not get back. If your speech is affected and you're worried you won't be understood clearly on the phone, call anyway. 911 dispatchers are trained to work with unclear or difficult speech, and simply saying stroke or repeating your address as best you can is enough to get help moving. Unlock your door if you're able to before symptoms worsen. If you notice early signs and you're still able to move safely, unlocking your front door means emergency responders don't lose time getting inside. This is a small detail, but in a situation where minutes matter, it removes one obstacle. Get to a safe, low position rather than remaining standing. Since balance and coordination can be affected, sitting or lying down in a stable position reduces your risk of a fall or additional injury while you wait for help, rather than trying to walk around your home. Note the time symptoms started, if you can. This detail matters enormously for the medical team, since treatment eligibility for certain stroke medications depends specifically on how long it's been since symptoms began. If you can note the time, even roughly, mention it to the 911 dispatcher and again to paramedics when they arrive. If you have a medical alert device or a smart speaker with an emergency calling feature, use it. For anyone who lives alone regularly, a wearable medical alert button or a smart home device configured to call for help by voice closes a real gap, since it doesn't require you to physically reach a phone or dial correctly if your coordination or hand function has been affected. Don't wait to see if it passes. This deserves repeating because it's the most common mistake. Some strokes cause symptoms that improve or resolve within minutes to hours on their own. This is called a transient ischemic attack, or TIA, sometimes referred to as a mini-stroke. A TIA is still a medical emergency requiring the same urgent evaluation as a full stroke, because it's a strong warning sign that a more serious stroke may follow, sometimes within days. The American Stroke Association is explicit on this point. Call 911 even if the symptoms go away. Don't dismiss it as something that resolved on its own. Setting yourself up in advance, before an emergency happens. A few things are worth doing now, while you're not in the middle of an emergency, specifically because they matter most if you're ever alone when symptoms start. Keep your phone within reach, especially overnight. A significant number of strokes occur during sleep or are first noticed upon waking. Keeping your phone on your nightstand rather than across the room or on silent in another location removes a real obstacle during exactly the situation this video is about. Consider a medical alert system if you live alone. These devices, worn as a pendant or wristband, allow you to call for help with the press of a button, without needing to locate, unlock, and dial a phone. For anyone living alone, particularly with any risk factors for stroke like high blood pressure, atrial fibrillation, or diabetes, this is a genuinely practical safety investment. Keep a card or note with your medications and medical conditions somewhere visible or easily grabbed, such as on the refrigerator or by the front door. Paramedics arriving to a stroke call benefit enormously from knowing your current medications, especially if you take blood thinners, since that directly affects which treatments are safe to give you. Talk to your doctor about your personal stroke risk factors, including blood pressure, atrial fibrillation, diabetes, and cholesterol, since managing these consistently is the most effective long-term way to reduce the chance you'll ever be in this situation in the first place. What not to do. Don't try to drive yourself to the hospital. Beyond the obvious safety risk if your coordination, vision, or consciousness is affected, arriving by ambulance means paramedics can begin certain evaluations and treatments on the way, and can alert the hospital's stroke team before you even arrive, which saves additional time once you're there. Don't take aspirin or any other medication on your own before calling for help. Unlike a heart attack, where aspirin is sometimes appropriately recommended, stroke treatment depends on knowing which type of stroke is occurring, and taking a blood-thinning medication like aspirin before that's determined could be harmful rather than helpful if the stroke involves bleeding rather than a blockage. Let the emergency medical team make that call. Don't wait to see how you feel in the morning if symptoms start at night. This is a common and understandable instinct, but given how quickly brain tissue is affected, it's exactly the kind of delay that turns a treatable event into permanent disability. Recognizing F.A.S.T, sudden balance problems, vision changes, face drooping, arm weakness, and speech difficulty, gives you a reliable way to identify a stroke in yourself, even without anyone else present to notice it for you. If you notice any of these signs, the single most important action is calling 911 immediately, before anything else, even if the symptoms seem to be improving or you're unsure how serious it is. Setting up a few simple things in advance, keeping your phone within reach, considering a medical alert device if you live alone, and keeping your medical information visible, closes the gap between having the right knowledge and actually being able to act on it in the moment that matters most.